This is Congressman Rodney Davis. I do want to say thank you for joining our live Tele-Town hall. Today, we're going to talk about vaccines and vaccinations. This is a great opportunity for us to talk about the successes that we've seen over the last year and a half fighting this deadly disease, and American ingenuity coming up with not just one vaccine, but 3 vaccines that every single American who's eligible can get now. I'm going to let the professionals that have joined us on this call, Dr. Dana Ray, the Chief Medical Officer of Crossing Healthcare, and Kent Tarro. He's the Administrator, CEO of the Macoupin County Public Health Department. These are the folks that have been on the front lines throughout this entire COVID pandemic, and now have been on the front lines getting these vaccinations out to those who needed them the most, and can hopefully give us an idea of what our economy and what our communities are going to look like over the next few months. So I'm glad that they've joined us. But for a few housekeeping issues, I know we've had some people join since I started talking. Thousands are on this call right now. Thank you for being here. So again, this is Congressman Rodney Davis. We appreciate you joining our live Tele-Town hall to talk about coronavirus and coronavirus vaccines. We've got great individuals who I'm going to introduce here momentarily. They're going to give us the most up-to-date information. The way this process is going to work, we're going to go through and let our 2 guests give some opening comments. I'm going to ask them some questions. And then after that, we want to hear from you. So stay on the line. If you think you have a question anytime I'm talking or anytime that Dr. Ray or Mr. Tarro are talking, go ahead and hit *3. You're not going to be disconnected. You're going to go to one of our screeners. You'll be able to put a question in the queue. And if your question is able to be asked and we get you on live, you're going to be able to ask me that question, and we'll relay it then to our 2 professionals. So with that, again, Rodney Davis here. Thanks for joining this important call where we talk about what's happened over the last year and a half. We talk about what public policy officials are doing in states like Illinois to hopefully get our economies fully back reopened to where we were pre-pandemic level. And we really want to talk about how the vaccine distribution is going in our communities. And I couldn't ask for 2 better guests, and I'm going to introduce the first one right now. And it's Dr. Dana Ray. Dana and I have known each other since I got elected to Congress just a few short years ago. And she's been somebody who's not just a doctor in the Decatur community and a member of our medical profession. She's somebody who jumped into the public policy arena as a city councilwoman in the city of Decatur for years. And I'm glad to hear her perspective, both on the policy, at the policy level, and with her medical degree and her medical profession in serving some of those who need health care the most in the Decatur area. Dr. Ray, I'm going to turn it over to you. Why don't you introduce yourself, talk about some of the things you've been doing, and thank you for joining us.
Thank you, Congressman, for having me on tonight. It is truly a privilege to be on the call and to be able to talk to the constituents about the importance of getting this vaccine. As the Congressman has stated, I am Dr. Dana Ray. I've been at Crossing Healthcare, which is a federally qualified health center, for the past 15 years, and I've been the Chief Medical Officer for the past 11 years. And I have also served, as he has alluded to, with City Council. I was on for 9 years on the City Council. The last couple of years I've been off and just been focusing on practicing medicine, which has kept me very busy this last year and a half. So why get the vaccine? The whole reason why we're strongly encouraging individuals to get the vaccine is because if we can reach herd immunity, and I know a lot of you have heard this comment in the past, but if we can reach herd immunity, what we can end up seeing is then the COVID virus will not have such a wide effect on individuals, causing as much devastation as it has over the past year and a half. Our goal is to decrease the number of individuals who are dying from COVID and who are hospitalized from COVID. Those are the 2 areas. Of course, hospitalizations is one area where we have seen a huge impact. And if we can decrease the number of individuals, again, being hospitalized, and then ultimately the number of individuals dying, then that will make the disease of COVID less impacting on our community, and we can get back to our quote-unquote normal.
Well, Doc, I really appreciate you joining us today, and I know you're going to answer a lot of questions on the vaccine, and we're ready to turn it over to another public health official, somebody I've known and worked with before I even got elected to Congress. Kent Tarro has been running the Macoupin County Health Department for, I'll let him tell you how long, because I don't want to age either one of us. But there aren't a lot of folks who has been dedicated to serving their communities more than I've seen Kent Tarro over the time and the years that I've known him. And remember, our county health departments have been on the front lines fighting COVID since this disease popped into our lives at the beginning of 2020, and they've been charged with getting vaccines out into our communities, especially in rural communities like those that Kent serves. And Kent, I know I've been I watched your clinic in Gillespie, and I was amazed how many you were getting through just a few short months ago. Give us a little, give everybody an idea of what's been happening, and just introduce yourselves, buddy, but I'm glad to have you on.
Well, thank you, Congressman. I appreciate you having me on. Yes, I am coming up on 38 years that I've served the county as the public health director, and now we also have a system of several federally qualified health centers to provide medical, dental, and psychiatric care. And 38 years, and I have never been so busy in my life. This is the biggest disease outbreak I have ever dealt with, and we have had several over the years, and actually it has been pretty deadly. It is unfortunately approaching some of the numbers as the Spanish flu did back in 1918 and 1919, and we did fight valiantly to provide measures of washing hands, distancing, masking, having businesses limit the way they were providing their services and selling their wares. And we weren't going to get to where we needed to get to until the vaccines were available. I applaud the federal government and all of you and your fellow congressmen and senators that we were able to put together vaccines so quickly. And I know this is the wave of the future, the messenger RNA. I know it's actually been used to provide more effective cancer treatment and will be used for many other things in the future, because I believe it was tested extremely professionally. All standards were met, and we have a very safe vaccines, I should say, that we've been able to provide. I am so appreciative of the staff that you got to see in action. We were at that time, we were probably vaccinating anywhere between 10 and 1,200 people within a given 4 or 5 hours. And now we are, of course, moving on to town pop-up clinic by age, by particular segments of society. And we have just stayed with it and will stay with it until the job is done. We have 35% of our population is fully vaccinated. 40% have had at least one vaccine. We vaccinated over, I believe, 17,000 people. My minimum goal is to get above 32,000 of our population here in Macoupin County vaccinated. We don't stop there, of course. Illinois has loosened up that we can vaccinate anybody from anywhere in the state of Illinois or anybody that works anywhere in the state of Illinois. So we are going as fast as we can, and we've worked together pretty well, I believe, to reduce this cause and effect. The more vaccines we give, the less positive COVID-19 cases there are, the less hospitalizations there are, the less deaths there are. And this has been public health at its best and most challenged in my 38 years.
Well, challenging is a good way to describe it. Hey, Look, I want to get to questions. I'm going to ask both of you some questions, but before I do, I want to do some more housekeeping. I know we've got a few thousand more people that have jumped on the call with us that are that have not been here since the beginning, because we're continuing to dial. New people will be joining us and jumping off as we continue to talk. So this is Rodney Davis, your congressman. We're here to talk live Tele-Town Hall about issues related to coronavirus and the coronavirus vaccine. If you've got questions, please hit *3. Go to one of our screeners. However, I want to tell you, we're keeping the questions related to COVID and to the vaccines because we've got two experts, Dr. Dana Ray from Crossing Healthcare, the chief medical officer there in Decatur. She's on the line to answer questions. Kent Tarro, the administrator CEO from Macoupin County Department of Public Health. These guys are professionals. We're not here to talk politics. You want to talk politics? You want to ask me a question about something not related to COVID and not related to the vaccine? Hit *0. We'll take your email. We'll get you a response, and we'll get you a response to any question that you want answered. So please, if you're on topic, hit *3. If you want to ask an off-topic question because you just can't help yourself, go ahead and hit *0, and I'll have somebody get your email address, and we'll get you a response. So here we are today. Dr. Ray, Kent, again, proud to have you here. Let's think back a year and a half ago. You know, we didn't know coronavirus existed in our lives. And with the last administration's Operation Warp Speed, we saw the American ingenuity come together working in public-private partnerships to get us 3 vaccines on the market. Kent mentioned and Dr. Ray mentioned the types of vaccines that we've had, but there's still a lot of questions going around. And there's sometimes a lot of misinformation out there on social media about what the risk factors are, what do these vaccines do. So, Dr. Ray, let's start with the most basic question. How do the vaccines work, and what do they do to your body?
All right. So that's an excellent question, as you stated, and that is one main thing that a lot of people want to know. So as many of you know, there's 3 vaccines that have been approved in the United States. 2 of them work by messenger RNA, which is the Pfizer and Moderna, and one works through a vector or adenovirus with DNA, which is the Johnson & Johnson vaccine. And let's start off with the Moderna and the Pfizer. Both of them work very, very similarly. They work via messenger RNA, and it's against one particular protein on the virus. So many of you have seen a picture of the virus. It's a circular-shaped virus, and it has these little spikes that are sticking off the virus. The messenger RNA vaccines works towards those little spikes that are on the virus. And the reason why those spikes are so important is those spikes is what the virus used in order to get into the human cell. And so the premise behind this is create a vaccine that will fight against the spikes so that the virus will not get into the human cells, causing the illness as we know as COVID. So with that messenger RNA, I want to emphasize the fact that this is not a live virus. So you're not given COVID in order to fight off the virus. It is just generating the proteins in your body to fight off, again, the spikes to the COVID vaccine. So when you receive the vaccine, you do not get COVID. You do not receive a live virus that's going to cause you to get COVID. So a lot of people have symptoms when they receive the COVID vaccine. What those symptoms are is we're trying to trigger your immune system to fight against those spikes that I talked about. And so when you first get the first initial shot, you're going to have some soreness at the injection site, and that is normal with every type of vaccine that you get. You get a sore muscle. You may end up having a low-grade temp. You may have some headaches. All of these are normal, again, vaccine side effects or vaccine symptoms. And it's, again, priming the immune system to fight against the virus. And so when you get the second dose, which is going to be 21 days after the Pfizer vaccine, or 28 days after the initial dose to get the Moderna vaccine, then this is causing your immune system to remember that we don't like that spike protein off that COVID virus, and we really need to rev up our immune system to fight against that protein. And that's why people have more symptoms when they get that second injection. And those symptoms are, again, the muscle aches at the site of injection, or pain at the site of injection. You might have some muscle aches. You may have a low-grade temp. You have some nausea, some vomiting. Some of the individuals who have symptoms have correlated it to symptoms like the influenza, feeling like you have the flu. Again, this is the response that we want the body to have, because we want to get it to rev up and to remember that protein and fight against it. These symptoms only last for a day or two. We don't want people to necessarily pre-medicate with taking Tylenol or ibuprofen beforehand. We want you to wait until your immune system starts to respond, because we don't want to do anything to damper the immune system. So after you begin having symptoms, you can either take Tylenol or ibuprofen, and I encourage you to talk to your doctor to see which one is safe for you to take, because if you have other health conditions, you might not necessarily be able to take one or the other. And so that, in a nutshell, is how the vaccines work to build that immune response so that you can prevent yourself from getting COVID-19, and also hopefully prevent from spreading it. Because, again, the end result is to decrease the number of individuals who are hospitalized with COVID, also the number of individuals ultimately who are dying from COVID. If we can make it to where it's a more mild symptoms, then that is this more desirable.
Dr. Ray, thank you very much. Very informative, and we appreciate you being on, and we love your expertise. I mean, we want to hear directly from the medical community. My constituents do, and which is exactly why we've got you on here. Kent, let me go to you real quick. You run a health department. I've been to your vaccination clinic in Gillespie. Most health departments run similar operations. Can you walk us through the process of how somebody might get the vaccine through their local health department, from booking an appointment to the day of vaccination, and what do you see in the future? Because the clinics are becoming less necessary when most people have gone through them. How do you get to those who can't get to the clinic?
We have actually been very successful in our clinics, and how people have got to us thus far is we have advertised on our website, on our Facebook page, on radio ads, on newspaper ads, and flyers, and in businesses, and we've tried to make it available to. We've actually done call-outs, mass calling to various organizations and medical communities and to people's homes. And one of the things that we have really concentrated on lately was doing the home visits to make sure that those people that have not been able to get out are able to get it. And we've really been pretty successful in that area as well. So how do people call? Actually, you don't even have to go onto a website or Facebook to register. You can call us. So we have a call center at both my Gillespie site and a call center at our home administrative office, and that still rings off the phone pretty well. You're right in that the demand is not as high, so we are really digging in, going from community to community, school to school. We have been the ones that have vaccinated in the long-term care homes, and are basically looking for new venues all the time. We've done a lot of drive-through clinics. We've done clinics at the county fairgrounds, at fire departments, and we're reaching anywhere in the community that we possibly can to make sure that people know that we're there, and actually have gotten others interested in providing the vaccine. We were 5 days a week, one of those days including Saturday, for months, And now we have both of our local hospitals involved, the pharmacies involved, some of the medical community, and what we will continue to do is try to encourage the medical community and other parts of the public health system that work with us to make sure that we keep getting more and more people on board so that there's almost no wrong door to go into to get that vaccine.
Well, Ken, thank you very much for that. And again, I know we've got some folks that are still joining us. We want to make sure that we get our questions and your questions answered. We've got a lot of questions in the queue for the Q&A portion, so I'm going to go ahead and just keep asking Dr. Ray a few questions and Ken a few questions, and then we'll open it up at some point. But if you still want to try and get in the queue, if you got a topic-related question, a COVID or a vaccine-related question, hit *3. You'll get to one of our screeners. If you want to ask an off-topic question, if you just can't help yourself to stay on topic, hit *0, or hit *0 if you'd just like to get an email update from us on a regular basis, get our newsletter. And these are the types of issues that we'll be talking about there, and we'll talk about a wide variety of things that are happening in Washington, D.C. So, Dr. Ray, do people need to get the vaccine if they're like me and they've tested positive for COVID in the past?
Yes, they do. If anyone who has it's been 14 days at least since you've had COVID, we encourage you to still get vaccinated. And the reason being is that the natural immunity that you receive from getting COVID only lasts for about 90 days. And so at that point, you do have the potential of getting COVID again. And there have been cases where there have been a number of patients who have received COVID a number of times. And so don't assume that just because you were sick with COVID that you now have immunity and you don't have to worry about getting the vaccination. You do need to get the vaccination. And again, if you're going to try to time it at a certain time period, anywhere between 14 to 90 days after you have been exposed to COVID, you should get that vaccine. And let me, if it's okay, Congressman, I didn't talk about the Johnson & Johnson vaccine. I did mention it, but I didn't talk about it specifically. And it is a DNA vaccine, and it does not change, again, the DNA of the human cells. I mean, that is one of the myths that is circulating around, is that the vaccine is going to change my DNA. It doesn't change your DNA, but it does, again, allow your body to create those proteins necessary to fight against the COVID virus. And that is a one injection vaccine. All three of the vaccines are most effective, and you have full immunity when it's been 2 weeks after you receive that last dose. And so it's 2 doses of the Pfizer, 21 days apart, 2 doses of Moderna, 28 days apart, and then the 1 dose of the vaccine. So 2 weeks after each one, one of those, then you're considered fully vaccinated.
Well, thank you, Doc. We appreciate that information. And Kent, your department is one that it operates in one of the largest area counties that we have in Illinois, in Macoupin County. A lot of rural areas within your jurisdiction. Give us an idea kind of what unique challenges you think counties like yours face in getting people vaccinated, and what's your message to rural residents specifically?
Well, I do want to let people know that anybody can get COVID, and it is a horrendous disease. We want to protect ourselves so we can also protect our friends, family, those we love. And what is critical is the distance between us. And as you know, a lot of rural areas do have more seniors. And that is one of the higher risks that we want to make sure that people understand. When you vaccinate yourself, even if you're a grandchild, you're really helping protect grandma and grandpa as well. And one of the things that we're going to continue to do is make ourselves available from town to town, to event to event. We've been at fairs, we've been at various events, and we will continue to do that until we are comfortable with the fact that we've gotten to the point where we just absolutely see this thing beat down. It's basically immunization against COVID-19. We are fighting a virus we've never fought before in my lifetime, and we want to make sure that people understand you are not protected just because you live in a rural area. And I've actually had friends and family have the illness, and in a severe case of it, it is horrendous to see people having to gasp and not being able to get enough air and oxygen to be able to relax and breathe. And just I have grown up really on this job, and I'm very mission oriented, and one of my key purposes is to prevent illness, suffering, and death. And I have seen more of it in the last year and a half than I have seen literally in the previous 36 and a half years. So I do want people to know that not only is it safe, but it is an illness you don't want to catch, and you don't want to have anything to do with spreading it. I also worry about this too. I think that we've been pretty lucky that some of the variants that have come in from other countries, that the vaccines that we have do protect against them, but we don't want to tempt the virus into too many mutations or variants, whatever you want to call it, because you're actually tempting it to continue to recycle itself. So by protecting yourself and protecting and making sure that your family and friends get it, you really are helping stomp this thing into the ground. So that's what we want to tell people. We'll get to you if you can't get to us, and do believe that this is a horrendous illness.
Well, I appreciate that, Kent, and we've seen that. Look, COVID took the life of one of my longtime friends, a good friend in Springfield, Rosemarie Long. And, I saw her fight that, spoke with her on the phone where she could barely catch her breath. I had COVID in August. My infection was pretty mild. I lost my taste and smell, but gained it back a few days after my quarantine was up. I've watched another good friend of mine who ran for charity. He was able to run 7 marathons in 7 continents in 7 days. I mean, this is a guy who's the epitome of physical fitness. He told me there were times when he was in the hospital that he thought he was going to die because of a COVID infection just earlier this year. So it can hit people very, very differently. We've got to take the disease very, very seriously. But here's the good news. The good news is we've seen COVID infection rates just dramatically falling because of the vaccine availability. We're seeing more and more Americans be able to follow the CDC guidelines and get back out into our communities. These are the types of things that I think show us that the successes we have as Americans to fight a disease that we didn't know existed in our country a year and a half ago. Now we're able to move back to some semblance of normalcy. But here's a big problem. This vaccine, for the first time I've seen in my lifetime, has become politically polarized. We saw a vice presidential candidate talk about not getting the vaccine if President Trump was still in office. Now we see polling show that somehow more Republicans in rural areas are a little more hesitant to get vaccines than others. Why? Let me ask both of you this, because you guys are professionals. We got a doctor and we've got a health department official that just want to make sure that our everyone they serve, regardless of who they are, who they vote for, gets the service, the treatment, and in this case now the vaccines they need. Why has this become so politically polarized? Start with you, Dr. Ray.
Okay. And honestly, I cannot answer why that took place. We have a lot of when emotions are tied to different things, it makes it difficult. And I understand that there are some individuals who have fears or who are apprehensive about getting the vaccine. And I want people to understand it's okay to have those emotions. What I'm charging people to do is make sure that when you have those feelings, So you do the work to get proper information. As you talked about, Congressman, there's a lot of misinformation that is going around, and we need to make sure that we do our part to get the right information out to people. I am so well pleased with what Macoupin County is doing as far as really working hard to get the proper information out to its constituents, to its residents in that county. And here in Macon County, we're working with our health department to do a lot of the same things. We have specifically talked to some of the African Americans in our community because the vaccine rate among African Americans is a lot lower than the general population. I am an African American female, for individuals who may not know that. And so seeing how COVID has really affected minorities or those who are have socioeconomic issues, who have prevented them to have some social disparities in care, and then now be the same group of people who are not taking advantage of receiving a vaccine, honestly is very scary. And so I have been doing my part with trying to address some of that misinformation. I've met with some of the African American clergy in our community and actually went to a church and talked to them about the benefits of getting the vaccine and addressing some of the myths that are out there. And I'm proud to say that type of information, those types of events have been successful. It takes time. And we have to make sure that we set that time aside so that we can address these issues so that people are no longer being held in fear as far as what the virus or the vaccine may do, but also dispelling the myths that this process has been rigged because of politics, because it's not. We're basing all of our actions and recommendations off of science. And we have to continue to be just that. We have to be scientists and look at this from a medical aspect and treat it as such.
Doc, thanks. Kent, what do you think? Why do you think this vaccine's become so politically polarized?
Well, I think it was unfortunate timing. People do get a little excited during political campaigns, and unfortunately, this really occurred, at a time that people are going to take shots at each other. And one of the things I tried to do was to do anything I could to rid people of anything to do with a political process. And I basically was able to do two things: convince people you have never seen a federal government go after creating a medicine so fast. I hope what this does is encourage us to take new leaps into new areas, whether that's more advances in cancer or Parkinson's or this, anything you can imagine, diabetes, etc. And I think that was one heck of an example of what this country could do, working together. I also think that as a public health leader, I have to lead by example. So the first thing I did was be the first one in the county to get the vaccine, which basically I had a lot of pictures taken. It went to the media, and we wanted to make sure that we absolutely believe we have a great opportunity that we can prevent, again, illness, suffering, and death. As far as politics, I have to tell you that I do believe there are a lot of stressors these days. Things move faster in the world than they used to. Science goes faster. The educational levels are greater, and that is a lot of stress. When you have a lot of stress, people are a little bit more on edge, and then add a political campaign to that, it makes it extremely tough. And I just thought it was really unfortunate of the year that it did happen, and I think that's part of it.
Well, I was in the midst of that campaign. I know sometimes, we're here talking about shots and the efficacy and the safety, and and giving Americans a choice to be able to get one of three vaccines. But I think I agree with you. It's impeccable timing with the political potshot season that we had with the presidential election and frankly, congressional elections and elections across the country. Hey, we're going to go to a few live questions. I know we've asked you some questions here. We've got some folks that are in here in the screening. I know we're not going to be able to get to every question. If you don't get your question asked, if you're not put on live by me in the time that we have left, stay on the line, ask your question, and we'll get it answered. We'll get those questions to Dr. Ray and to Kent, and we'll get answers for you. But we're going to start with Robert from Springfield. Robert, you're going to go live here in just a second for Dr. Ray and for Kent Tarro. Hang on. I think you should be live. Robert from Springfield, are you on?
Yes, I am. Thank you.
Go ahead and ask your question, Robert.
Yes, my question is, I have a grandson and a granddaughter that are in first and second grade, so are obviously not old enough to have the vaccination as of yet. What is the estimated time that they might be eligible to be immune to receive the immunity shot? Excuse me.
So that's a good question. They're still in a process of doing additional studies in individuals in that age range to see, again, what the dosage should be, as well as the effectiveness of the vaccine, and also to determine if there's going to be any issues as far as side effects with receiving the vaccine at that age group. The studies are ongoing. Moderna just started some studies at the end of March with that, and Pfizer has been doing the same. And hopefully by the end of the year, beginning of 2022, we should be able to get more information on that.
I appreciate that very much.
Yes, sir.
Hey, thank you, Robert. We appreciate you calling in and asking those questions. While we get to the next call, real quick, Doc, give us your opinion on how safe this is for kids who are eligible.
It is safe. It is very safe. I am the mother of a 10-year-old, and he wishes he was old enough to get the vaccine. And honestly, I am going to allow him to receive the vaccine. So what we've seen is that the side effects and symptoms that individuals in that 12 to 18 range have received as far as getting the COVID-19 is very similar to what adults have been receiving as well. So that's reassuring. I know there has been some people who have thought that it is going to affect fertility or that it is going to stunt a child's growth, and the fact that there hasn't been any long-term studies. And, of course, there aren't any long-term studies, but I can unequivocally tell you that it does not cause any issues with infertility, and the American Reproductive Society has also backed that, and it does not cause any issues as far as with studying growth. There is no, I can't think of a pathological pathway that would end up even causing that. It's stimulating an immune response is not going to affect the growth hormones and a child being able to grow. And so basically what I'm telling you in a very long-winded way is that it is very effective in children. And again, when we're looking at trying to reach herd immunity and trying to get as many people vaccinated as possible, the next level of risk for individuals is going to be those individuals that are unvaccinated. So just as the grandfather was talking about as far as his grandkids, the likelihood of him receiving COVID will possibly be from his grandchildren, and there will be the individuals spreading more of the disease. And we're seeing that now. And when we're looking at the statistics of the individuals who are receiving COVID, it's those who are younger who are receiving COVID and not so much of the older population. And they're our most vulnerable people.
Go ahead.
No, I was about to say, and that is our most vulnerable age group are our elderly. And so we need to make sure that we're protecting the most vulnerable individuals.
And the good news is, you got counties like Jersey County and others that I've been to. The population of 65 and above are over 70% of the vaccination rate. So that changes their survivability tables for all age groups because we know from studies are showing that the vaccines that are on the market are 100%, virtually 100% effective against rehospitalization and death. And as even Dr. Fauci recently said that once you get one of the vaccines, you become kind of a dead-end carrier. So you don't give it, and you can't get an infection that's going to hospitalize you. So these are the types of issues that we wanted to address tonight. So next question, we've got Bill from Litchfield. He's got a great question about being allergic to a lot of medicines, and what about the VA? Bill, you're going to be on?
Yes, I am here, Congressman.
There you are, buddy. Why don't you ask Doc and Kent about your questions?
Okay, first off, I'm 74 years old. I am highly allergic to a lot of medications, even Tylenol. Should I get the vaccine? I don't hear a response.
No, I was unmuting myself. I apologize. So with that, honestly, I'm going to defer to your doctor in that situation because they know about more of your health issues. In individuals who are highly allergic to a wide variety of items, then we're encouraging them to talk to their provider. And you may be one who needs, if you do get the vaccine, is to get it in a hospital setting so that if you need to receive medications to counteract it, you can receive that at the time that you are administered the vaccine. I will let you know that at Crossing Healthcare, and I'm sure even at Macoupin County, most of the places where they're giving vaccines, they do have emergency medications on hand in case someone has an anaphylaxis response to it. Again, this is a medical emergency, and so we want to try to mitigate as many of that as possible, which is why we want people to stick around for 15 minutes so that you can get the appropriate medical response if you do have adverse reactions.
Okay, now my other question, I'm 100% VA healthcare. I'm also legally blind. I cannot drive. I have to have somebody. So if I have to go to a hospital, that's 135 miles round trip. Somebody has to take me. Can I go to my local hospital here in town and get this done?
Yeah, I would check to see if they have it on hand. There are some facilities that don't have certain vaccines because of the restrictions as far as being able to store it. Pfizer is one that is the particularly hardest as far as storage. Johnson & Johnson vaccine is the easiest as far as storage because it can essentially be kept in a regular refrigerator. So I would contact my local hospital to see what they have on hand to see if they will be able to accommodate. I don't know if
Bill,
Kent has...
to give you a little optimism, yes, St. Francis Hospital was providing vaccinations, and they have been for some time. And I think you just have to call ahead. You'll have to do the screening, and of course they'll want to be prepared for you if you do. Your physician says that is a good idea, and yes, we would tell you the same thing, that you would want to have that done in the hospital setting, and they would want to observe. We usually observe 15 minutes, but they would probably observe 30, 45 minutes for you then. But I do believe St. Francis can help you out.
Well, Bill, thank you very much for your questions, and I hope that information helps you out. We've got some more questions that we want to get to, Dr. Ray and Kent, and I just appreciate the folks that have been on the line. We want to make sure we get to your questions. Let me go ahead and go to Larry in Jerseyville. Larry, you're going to be coming on here. What's your question for Dr. Ray and Kent Tarro?
Yes, if your immune system is 98% pure, why would you need a vaccine?
Okay, that is a good question. So our immune system is able to respond to different things that's going on. As I talked about initially on the phone call, our natural immunity to COVID only lasts for about 90 days. And so then the risk of you getting reinfected with COVID is possible. So when you receive the COVID vaccine, it triggers your immune system to remember the COVID virus and fight against it. And the immunity has, now we're seeing, last anywhere from 6 months to a year, because that's how long the studies have been out now. So our immunity with receiving the vaccine lasts anywhere from 6 months to a year, which is why we're encouraging individuals to get the vaccine and not just rely on natural immunity, because it doesn't last very long. The other thing that I encourage people or I'm informing people about, is that as we age, our immune system is not as good as it was when we were younger, and so our innate immunity is diminished as we age. And so that means that you don't fight off infections as well as you did when you were younger.
Well, thank you for answering that, and you know, this is why we want to get our questions answered. I mean, there are a lot of unanswered questions and speculation about COVID. Doc and Kent, you guys have mentioned that you know, the antibody levels for those who have had COVID, they go down over time. You know, I had a mild case in August, and I went to donate my plasma to hopefully be used for one of the therapeutics for those who got COVID before the vaccines were developed, and can still be used today for mononuclear. The antibody treatment, plasma antibody treatment that's used to effectively help people who have a bad COVID infection. But my antibody levels were not high enough for them to be able to use that. I don't know if it was because my infection was mild, but a former colleague of mine who had a really major case that hospitalized him in March, he had high antibody levels when he first started giving plasma, but he told me as he continued to give plasma throughout the year, his antibody levels did go down, and they dropped in half by the last time I saw him last fall. So we see the science behind it, and now we have the vaccines, and we have the therapeutics like the antibody plasma. We have other drugs that are helping raise the survivability rate. And I think a lot of the questions that I see left in the queue are talking about when are we going to be reopened? Look, you guys are in a fight. It's tough. It's because policymakers have to make decisions based on risk. And we're seeing the risk of dying through COVID dramatically change as we've seen vaccines become more available and more widely used. We see the CDC has changed guidelines. When do we get back to normal? Let me ask both of you. Kent, let me start with you.
Well, I think we're still going to have to be cautious, but I did want to let you know that I have made the decision to work with, in rural areas, celebrations are a big deal. Well, they probably are everywhere, but maybe they're even bigger in the rural areas. So of course, we have some guidelines we try to follow, but I have been working with everybody that has come to me under certain standards to help them open back up. I'll give you a couple of examples. Gillespie Black Diamond Days. Now, they're not going to have it in downtown Gillespie, but they're going to have it out at the Gillespie Lake. And, you know, we've set up some guidelines that we think will help make sure that we minimize, if not zero, the risk of spreading of COVID. And we've done the same thing for a trap shooting range. They have a state tournament. You know, it's not going to be exactly like it was where anybody could do anything and everybody was hugging and kissing each other or whatever. But we have opened up and basically worked with our county fair to open back up. We have worked with a couple of small events in the southern part of the county, and I'm kind of a believer too that you know, there is a lot of effect that's taken place by people being isolated and not being able to connect with each other. And I would like to just slowly see that open back up, because I think that's important for people too. And there is something to people being socially connected that helps you stay healthy as well. And I think even your immune system, there is a lot to do with when people are more content and happy, the immune system is a little bit stronger. And that's one of the things that I think is significant. And I think we've had an impact from COVID that we don't even totally understand that impact yet. So I'm not saying everybody can do whatever they want. We have certain guidelines, but we are getting very close to fully opening back up, and we are trying to help people make that first step. And I have to tell you, the smile on people's faces, they see me walk in the room, and I'm kind of pretty sure that the devil has just walked in. And when I turn around and say, let's try to work this out, the smiles on their face were unbelievable. People are so pent up. So I'm thinking it's coming, and I'm helping take those next steps.
That's what we need. We got to get back to normal. I'm an advocate for reassessing the risk right now and continuing to follow the guidelines that are only getting better. And I also say on a regular basis, Kent and Dr. Ray, if we get the vaccines, it gives policymakers less of a chance to keep us in lockdown. So take the excuses away. Those are the messages I see. Dr. Ray, a quick question for you, a little more related. We saw some data come out of Decatur not too long ago where 4 in 10 freshman students were failing. That's a 40% failure rate because of remote learning and the situation that many found themselves in school districts throughout the nation and in particular in my district. Do you agree that we should be going to reopen our schools, and what can we do to get kids back on track?
So the pandemic has really highlighted different learning styles and how, different learning styles is not the best for every individual. It is very sad the fact that we're seeing a large number of individuals who are failing, even more individuals who are dropping out of school, and people who don't have resources really falling behind even more as a result of the pandemic. And it's sort of really truly highlighting our social disparities that's going on in our world, in our country right now. As far as individuals returning to school, I believe that we are going to have to be creative and look at what needs to be done so that we can get our children back, because we're seeing a wider gap in the educational outcomes of our youth as a result of it. So if that is, the CDC changed the guidelines to where it's 3 feet distance and wearing the mask. We have to look at what needs to be done in order for our kids to receive the proper education, because that's what's truly going to end up changing their lives. That's going to give them an opportunity to become the future doctors and lawyers, and to be able to really change their economic outlook later in life. So I am for us trying to get back to having our children in school, but again, we need to be creative in that process, because as Ken had just alluded to, we're turning the corner. I want to make sure we continue to turn the corner and we continue to see that downward trend, and I don't want us to take our foot off the gas too quick, because I don't want to see a resurgence. And the more people that we can get vaccinated, even, going down to the 12 years in age and up, the better we will be in the long run.
Well, thanks, Doc. I don't think I agree with the assessment there as much. I think we've got a lot of data, even in my district, from schools that have been in person all year, like Carlinville in Macoupin County. I think it's safe to get these kids back, and I agree with you. The disparities have just been overwhelming, and a lot of kids are failing, and I think we need to be back in school, in person learning, and happy to work with you in Decatur and other places throughout our district to show some of the efficacy of what's been done in other school districts, and really not a lot of difference when it comes to infection rates for in-person learning at school districts versus others. And I'm interested to see what the failure rate is from in-person learning versus those who are remote, and especially in the districts that like the one I mentioned, where we see data where kids are just falling behind. So I think we got to get our kids back in school. I think we've got to get back to normal as soon as possible. Remember, everyone on the line, Doc and Kent, these guys are healthcare professionals. They've been fighting the fight the whole time. They may have some different opinions than you, me, and others, but that's why we have them on here. We want to make sure that everybody gets a chance to have their voice heard and to be listened to, and that's why we did this tonight. Dr. Ray, I want to thank you for being on here. You're always a friend. You're always somebody who speaks your mind, always going to give us the best information possible. And Kent, thank you for being on here, too. The exact same thing goes for you. You've always been there on the front lines. Both of you deserve to be commended for the fight that you have waged in your communities over this pandemic. And I do believe, and I think you guys will agree, that we do see light at the end of the tunnel. We're going to be able to get back to normal much more quickly. But I do want to thank you for helping to encourage folks to know that these vaccines are safe. I do know that, obviously all three vaccines are working under emergency use authorization, but that FDA approval process has not been sacrificed versus just because it's a pandemic. I think having not just one but three vaccines and seeing millions of people safely get them is proof that we're seeing the infection rates continue to go down and the risk continue to change in our favor. I know we had some questions about the gain of function studies. Hey, if you've got a question about that, be happy to keep you updated on any investigations that are happening in Washington. Hit *0, leave your email, and we'll get back to you with answers to it. Any other questions we didn't get to, please stay on the line. Stay on the line. You can get any of your questions answered. If you have any more questions for me, for Dr. Ray, again, if you can't help yourself, you want to ask about presidential elections, you don't want to ask on topic, just stay on the line, ask your question, say something about me if you want. I mean, that's the time you can say the fun things too if you'd like. Go ahead. We'll be happy to get back to you and get answers. But thank you for being on the call. Dr. Ray, Kent, I appreciate your time. I hope you guys have both enjoyed it, but you play a very large role in getting my constituents in the 13th District the best information from both of you who have been fighting this the entire pandemic. So my hat's off to both of you. Thanks for your friendship. Thanks for your leadership. And we're going to end this Tele-Town Hall. Stay on the line. If you've got a question, we'll get you a chance to leave that question, or if you want to leave a voicemail, or if you want to get more info from us, stay on the line. We'll be right with you. Thanks, Doc. Thanks, Kent. Take care, everyone.
Thank you, Rodney.
Thanks for being on the line.
Thank you.